Welcome everyone to today's podcast. I'm Reem Al Falasi, an emergency medicine physician and an intensivist at the Cleveland Clinic Abu Dhabi, as well as a vice chair of education at the Critical Care Division. Today we have a special episode focusing on the Integrated Hospital Institute, Women in White Coats. We will explore the significant contributions of female physicians, the challenges they face, and how they continue to shape the landscape of medicine. I'm joined by two distinguished guests, women that I'm honored to call my colleagues and my mentors. First, we have Dr. Saniya Khan and Dr. Shaza Karrar. Dr. Saniya, tell us more about yourself and what you do.
Thank you, first of all, for allowing me to join this podcast today. So I'm by training a pulmonary and critical care physician, completed my training in 2010 and actually moved to Cleveland Clinic Abu Dhabi in 2015 as one of the initial group of women who joined the Respiratory and Critical Care Institute. At the time I had other trailblazing women with me, whom I must mention, Dr. Samar Farha, who originally started the pulmonary hypertension program, and Dr. Sobia Farooq, who originally started the sleep program and was the original pulmonary function lab director and sleep director. So I was in company of some amazing women who allowed us to move forward as the years went along.
And Dr. Shaza, can you tell us more about what you do?
I'm an emergency medicine attending. I graduated from Zayed Military Hospital. I joined Cleveland Clinic Abu Dhabi in 2019. Since my journey began in Cleveland Clinic Abu Dhabi, I've been focused on medical education, promoting medical toxicology, and improving clinical operations.
Excellent. So the Integrated Hospital Institute is a new institute within our hospital. Do you want to tell us more about that?
Definitely. So the Integrated Hospital Institute, it's a new operational module that integrates multiple divisions. If I can mention some of these divisions, they include the Emergency Medicine Division, Hospital Medicine Division, Critical Care, Pulmonology, Anesthesiology, and I think as well infectious disease.
Yes, correct.
Did I miss out on any
Correct.
of them?
No,
Yeah.
correct, yeah.
The unique thing about the Integrated Hospital operational module is that it helps us enable a continuum of care and a longitudinal patient care that can really reflect in the patient's journey. The other thing that it allows us to be scalable on a global forefront and continue to grow operationally and clinically with excellent outcomes.
That's wonderful. And the other question that I had that we spoke about earlier, especially with Dr. Sonia Khan, since you've been here in this institution for almost 9 or even 10 years,
yeah.
Since the beginning of the institution, you've seen a lot of women that have built this institution from the ground up. Can you tell us more about that?
So we, if you look at our numbers, perhaps, when we started off, as a new organization, obviously, the ratio of male to female physicians fell short of what I suppose internationally acceptable or Western standards of representation are. But the women who were involved were very instrumental in pushing these programs forward. And I can speak for myself that I was under the tutelage of some very nurturing colleagues. Jeffrey Chapman was our first chair of the Combined Respiratory Critical Care Institute, who helped foster a culture of inclusion and equity. And, we all had a voice, we all had a purpose, and we were all allowed to practice the way we all think we should practice without having any issues with gender disparity. And of course, there were challenges along the way. As a female physician, we have our challenges, which we fight on a day-to-day basis. And I think, Shaza, you're pretty aware of those in your institution as well, yeah?
Definitely. I'm still a young professional, even though the years are passing by. But I have came to acknowledge challenges that a female physician from a professional age going forward. So these can include visibility or invisibility, having empowerment from colleagues, whether female physicians or not, leadership roles and availability and opportunities that are promoted for women to have a chance to take part in. I believe this is something that I also really try to empower in my mentees and our junior physicians, from interns or residents or medical students, is that it takes more than just being a clinician in your career and your medical journey. There's a lot of professional growth that comes into place, having to work hard to prove yourself, to actually enforce your presence.
Your presence, yeah.
Yeah, definitely.
Yeah.
I'm sure that you have more to say, given that you had a head start, and you've been here from the beginning.
So, and I think in the end, right, if you all have the mission right, so obviously I was from the band of physicians who just knew that you had to make this work by hook or by crook, right? And, there were days where you felt like you were a medical student, the intern, the house officer, you were everything, and you were doing high level thinking right at the top of your license level, right? You were doing that all because the mission was that this had to move forward. We started with 6 ICU beds. We were, I think, 8 or 10 physicians, 6 ICU beds, and expanded very rapidly to 24, then 48 with the same amount of people. It was a lot of blood, sweat, and tears. And the distinction between the male and female was gone because we were all part of this team, and the mission was that we had to move forward.
100%. And I know in earlier conversations you also spoke about other women that helped shape some of our departments, like the emergency medicine division, as well as the anesthesia division.
Absolutely. Exactly. So the hospitalist medicine, all of them had some very smart female physicians who were integrated in the institutions, who started all the initial, creating all the initial policies, the initial frameworks. You have to remember, everything started from scratch. There was nothing. There was no policy. And now we were just talking about this the other day, that now we've come to the point where we can actually take policies and substratify them and just work towards real clinical excellence and quality of care, keeping in mind patient safety. Absolutely. So we're obviously far from where we were when we started, yeah.
And how do you see women being a part of building a culture of excellence within our institution?
So you brought a very important keyword. So I believe as female physicians, or even male physicians, we all have a common goal, which is the establishing a culture of excellence, and having these goals and aims and keys that are that we strive to reach in Cleveland Clinic. It's a goal for everybody. When it comes to female physicians, I think seeing older role models in the institute and in the division and in other divisions really helped promote younger physicians, younger professional, in either it's in our early stage or middle stage, to kind of achieve that goal, to reach clinical excellence and having a culture of excellence. I believe this is a set point that we have to keep an eye on, and kind of prove the strength and power that female physicians have to add to these divisions, whether it's a clinical or an administrative role or even a leadership role.
And if I may add to that, you talk about having an infrastructure, right? There's the structural infrastructure, but we are young enough as an organization that we can really take control of the culture that we are trying to create and sustain, right? So having a culture of the cultural infrastructure is key over here. And I think when you have different levels of professionals at different stages in life, that's actually an excellent, I shouldn't use the word playground, but literally it's a playground where we all can really exercise inclusivity. And, the onus falls on the more senior people like myself to recognize new talent, hone in on new talent, mentor people, bring them up, take them under your wings. That falls on us. And but that, as an organization, we have to make that as part of the main protoplasm of the culture, that this is what we are going to, part of our mission, to have the culture of excellence, and the culture of inclusion and equity.
I absolutely agree, and I feel this ripples as a continuum from the seniors leading the institution, going all the way to the point of the new intern that
Entry
just
level,
joined us, or just a new resident.
Yeah.
Is seeing that by proving yourself, by engaging, by being involved, by contributing to the culture of excellence,
Yeah.
you're actually being seen, you're being heard, you're enriching the achievements of your institution as a whole. And I believe this continuum can go on for the next 10 years and the next 10 years and the next 10
Absolutely.
years. So in
Yeah.
20 years, I'll be all, or 50, I don't know, 30 years, I'll be all grayed out and hopefully wiser. But I would like to see the same drive, the same commitment that most likely was reflected and inspired to my younger generations before me. So I feel this is an investment that needs to be started from now going forward. Like, what are our goals and visions in the next 10 years? So let's say for female physicians, what is our vision that we want to see in our female leaders and female physicians going forward?
And I think for female physicians, as both mentors and mentees, right, what is important to distinguish is that, no woman brings her profession to the table without leaving her other life behind, right? And, the distinction that we keep trying to make about keeping the two separate, it's a hard distinction. And what I've learned the hard way, and also through my mentors, is that if that is part of you, what defines you and stays with you, that is your strength as well. You just need people to understand and accept that. And that's not going to take away from your professional contributions. So if you are defined as a physician, you are just as well defined as a mother or a wife or a daughter, or someone who has all these other responsibilities. And it doesn't take away from your professional excellence, really. And I think we have to stop making excuses for that and stop being ashamed about that. Because that is, again, part of our protoplasm, and it defines us.
I agree, and I think it also is part of the special component of what makes a female physician. That we bring in empathy, we bring in
absolutely. You see an elderly patient, and you see your parents.
I see my mom
that,
in her.
right?
Yeah,
you see
I see my dad.
Your struggles with this elderly patient, or a family's struggle with their elderly parents are the same struggles as yours, and you completely empathize with that, and can really modulate your expectations and the kind of care that you provide based on that.
And I think that's why it's really important to work towards getting our female workforce, or increasing our female workforce within our institution, because I think women add so much to our institution. When you talk about equity, empathy, working with other people in the institutions, bringing everyone together. I know that we spoke about that earlier as well in other conversations, but about how is it that we're going to try to create an environment that brings in more females to the Integrated Hospital Institute or to Cleveland Clinic Abu Dhabi. Can you tell us more about your experiences in working with other women or bringing other women on board to our institution?
So, when we said, we started obviously with a very small proportion of women. And first of all, it was hard to find anyone to sort of take the risk or the jump to a newer organization. And what we were lucky with was that, again, the people who were there in the beginning, a lot of whom have left, a lot of them who've stayed on, the mission always was that this has to work, and this has to work in the best way possible. And we have managed to attract amazing women for not only just to become part of the general workforce, but to come in as someone with a purpose. And we are less in number, but our impact factor is pretty high. Like yourself, Shaza, so I myself am involved in some key areas in advanced lung disease, providing perhaps the only advanced lung disease service in the country, actually. And we've managed to become a big referral center for the region for advanced lung disease. And a lot of my counterparts, female counterparts, were instrumental in helping that come through. And similarly for you, Shaza, I believe that you have managed to create a role for yourself in the trauma world, yeah?
Definitely, yeah. So, as the Emergency Medicine Institute, as much as we provide excellence as a stroke center, as a heart center, we provide care for all types of patients with any sort of complaint, and an injured patient isn't any different. So, we've been working on analyzing and assessing any systemic gaps and improving our coordinated care when it comes to the injured patient and trauma patients, and to align with the regulators as well. And similarly to all kinds of patients that walk through our doors, we work on improving our clinical operations and having delivery of appropriate care, timed care, with excellence and appropriate dispositions. That filters as well through to education. We are a teaching center, and we have a myriad of trainees on multiple levels that rotate within our department, and we try to instill that knowledge and experience and even like professional skills into them from an early stage.
And then to answer your question, what are we doing to foster that culture? It all comes down to the same thing, right? Recognition of capability, recognition of professionalism, of potential, and mentoring that and fostering that. And that, I think, is, for all of us who are here, that's actually no less than a responsibility. Because if we have to move forward not only with the overall culture, but also empowering our female physicians to be the best version of themselves, the responsibility falls a lot on us as well, who are here already, to foster that culture.
100%. One thing that I take away from our conversation and our shared experiences here within the Integrated Hospital Institute is that women are really empowered here, and we're given a lot of opportunities to take on leadership roles. And I think with the leadership of Dr. Jose Diaz, I've seen a lot of that within my division, and I hear about a lot of that within the other divisions, emergency medicine, pulmonology, and I'm very grateful for this opportunity. There's a lot of mentorship, a lot of support, and a lot of opportunities to really grow within Cleveland Clinic Abu Dhabi. Thank you so much, ladies, for your time and for this interview, sharing your invaluable insights and experiences. We're very grateful for that. Your contributions have shed a light on the vital role of women in our Integrated Hospital Institute and beyond. To our audience, thank you for tuning in and being a part of this important conversation. We hope you find this discussion enlightening and inspiring. Please continue to follow our podcast for more discussions on the impactful work being done at the Integrated Hospital Institute at Cleveland Clinic Abu Dhabi. Until next time, take care and stay well.